Whenever you're ready, Assemblymember Cooper.
Thank you, Mr. Chair and members. AB 1018 allows local education agencies and special education local plan areas to provide mental health services to Medi-Cal eligible students under the Federal Early and Periodic Screening, Diagnosis, and Treatment Program. The goal is to allow LAEs to submit claims directly to the Department of Health Care Services for EP-SDT services for eligible students as opposed to going through county mental health or a managed care program. The EP-SDT Medi-Cal funding that has always been part of the total funding package for serving the I respectfully ask for your aye vote.
Thank you. Witnesses in support.
Good afternoon, honorable committee members. My name is Bill Tolstrup. I am the Director of Special Education, the Special Education Local Planning Area in our District Wellness Initiative for the Elk Grove Unified School District, the 5th largest district in the state of California and the largest in Northern California. In more than 40 years of education, I've seen more and more placed at the feet of education to provide and address the issues of the whole child. In our previous service delivery model under 3632, Elk Grove had 129 students accessing mental health services. After 2 years of implementation and school-based and site-based access, we currently have 577 students who are accessing services. As you may be aware, we have a number of kids that are within the areas of poverty in the city of Sacramento and a lack of access. We have a considerable number of students that are suffering from what's called complex post-traumatic stress disorder, even more difficult to deal with when the PTSD of our returning servicemen based on the current reality of they live within that environment. AB 1018 allows school-based access and immediate services for students to address the ever-rising concerns around mental health and the condition of our students. With accessing EPSDT, without being able to do that, it's like going into a boxing match with one arm tied behind your back. It's critical that we have access to all funding to enhance services not only for students but for their families, and that we're able to look at early intervening and diagnostic and treatment so that our students, in our mantra of wellness within the Elk Grove Unified School District, healthy body, healthy mind, healthy learning. Thank you.
Thank you, members, for hearing our bill. I am Camille Giametti-May, and I'm the Assistant Superintendent for Yolo County SELPA, and I'm also a representative of our SOAR group, which is working with Assemblymember Cooper on this bill. I want to thank you for your attention today regarding this bill. Our SELPA, Yolo County SELPA, is a rural SELPA, but we have many pockets of such as Davis and the university, so we have a very mixed population. We are one of the SELPAs that very successfully transitioned into the AB 114, transition from 3632 into 114. Our population is much smaller than Elk Grove's. However, we have increased our services to students with IEPs for mental health services. We went over 50%. We are now serving up to 135 students. In fact, I have one of my clinicians here with me today. Again, EPSDT is a funding stream that many states currently access. We are not for these site-based services, and we strongly would request your aye vote on this bill. Thank you.
Thank you. Additional witnesses in support.
Eduardo Martinez, California Medical Association, in support.
Jeff Vaca, representing the California Association of School Business Officials, in support.
Nancy Lacoste, representing the Coalition for Adequate Funding for Special Education and its over 100 members, in support of the bill.
Good afternoon. My name is Shelton Yip. I am here to represent the state SELPA organization, over 130 SELPAs in the state of California, in support.
Additional witnesses in support.
Mr. Chairman, Jeff Frost. I'm the legislative advocate for the SOAR Coalition, but also representing the California Association of School Psychologists, in support of the bill. Happy to answer any questions.
Thank you. Additional witnesses in support. Seeing none. Witnesses in opposition, please come forward.
Mr. Chairman, Rusty Seelix, California Council of Community Mental Health Agencies. 4 years ago, when the legislature realigned this program from counties to schools, it did not eliminate the federal entitlement that these students also have to county mental health services. Counties are obligated to provide all medically necessary mental health services to our Medi-Cal youth. The schools were given 3 options to handle the responsibilities. One was to contract the whole program back through the counties. Another was to contract with providers that counties work with. And the third is schools trying to do it themselves. The problems that led to this bill are only where schools have tried to do it themselves. The result when a school tries to do it themselves and doesn't partner with counties is problems are ignored until it is too late. The better model is for counties and schools to partner together and bring help on campus to these youth before they're in special education, and that way there would be fewer children. That is the model that we're promoting, and we think that's a better approach to this, is to get counties and schools to work together instead of expanding this approach of schools on their own. In addition, it's a strong departure from the model the Department of Health Care Services has been pursuing in Medi-Cal. We've been trying to move to a Medi-Cal managed care system. County mental health is a Medi-Cal managed care system. This is expanding a fee-for-service model. We think it goes against the grain of how things should be done. And of course, the bill may not work. It requires a state plan amendment and federal approval, which might not be easy to obtain. Thank you. For these reasons, we think there's a better approach to this problem.
Thank you. Additional witnesses in opposition. Seeing none, Assemblymember Ridley Thomas.
Yes,
Questions
Mr.
from committee
Felix,
members.
before you depart, what are your suggestions for an affirmative step with this bill? Because it seems to me that this is trying to reach a pretty difficult to reach population.
In almost all of the state, this population is reached through a cooperative agreement between county mental health and the schools. We think that's the solution. We are aware of places where counties have said they won't serve these students. We think the legislature should reaffirm the obligation of counties to serve these students and direct the schools to work with their counties in a cooperative agreement. We think that any place where there isn't a cooperative agreement between the counties and the schools is a recipe for failure. And they're seeing the failures. We think there's better solutions.
Can you cite or are you just aware of any counties where we don't have those? Like, are there half of the counties? Is it most of the counties do not have agreements, or what?
My sense is these agreements are in place in nearly every major county. I can't speak to the rural areas.
So then, does that mean that
in
your
fact,
last point
my
is
sense is that even in Mr. Cooper's county in Sacramento, these agreements exist with some of the other school districts. So I'm troubled to understand exactly why this bill is the solution that they're pursuing. We think there are other ones. I'd be happy to sit down with them and try to figure out other solutions. This just doesn't seem to us to be the right way to solve this problem.
Mr. Cooper, do you know if the mental health department in Sacramento County is working with your school districts or your education service? And I know we have a Yolo County representative there.
Right. Mr. Ridley Thomas, Jeff Frost representing the SOAR Coalition. To address Mr. Seelig's argument that there should be a partnership, we would wholeheartedly 100% agree with that. The difficulty is that, as my clients can indicate firsthand, they have gone to county mental health, which is the entity that must interface based on the state plan with the federal government. And we have not been able to come to agreement with them. They have either asked for significantly high overhead fees or have told us no. That does not sound like a partnership to us. We're not interested in doing legislation when we can do this administratively. We have just found that we've been unable to. That's the difficulty.
Well, I know that, Mr. Cooper, you indicated to me in your long record of service suggests that you want to get the best solutions and make it real and impact quality of life. I moved the bill. I'm going to support it. Hopefully the counties can work with the local education agencies and other providers to reach a solution. We shouldn't be bickering when we have kids on the line, families on the line, and services on the line. And if we're going to get the public to embrace our investment in mental health services, we've finally broken through the challenges in investing in mental health services. We can't let squabbles blow that up. So I'm supporting the bill for now. Hopefully, Mr. Cooper, you can be a mediator, as your legacy suggests, to bring disparate factions together. Thank you, Mr. Chairman.
Assemblymember Thurmond.
Thank you, Mr. Chair. I'd like to get some clarity on how this is going to work, because this is the first time I've ever heard of an arrangement where the funds for EPSDT did not come through behavioral health at the county level. And the two counties that I represent, I've worked with extensively, who administer the money to various nonprofits and CBOs, who then provide the mental health services and special education services directly in the school community. This is the first that I've heard of a stalemate, if you will, where there is not the participation of the county to work with the local education agency to make sure those services are happening. I guess I'm at a loss. I seconded this so that we could have the discussion. When the motion got made, there was no second, but I seconded it for discussion because I think it's important to hear it. But there are so few EPSDT dollars available. I don't want to end up in a situation where we limit what the kids actually get as a result of whatever this squabble or disagreement is. Mr. Cooper, could your witnesses shed some light on why the county wouldn't just provide the money through behavioral health to local agencies that are able to provide the services, unless there are no agencies in your county who can serve your education association?
I can speak for Elk Grove Unified School District and most of Sacramento County. We have worked collaboratively with Sacramento County Mental Health. The issue that we faced often is a lack of service providers or students' lack of the ability to access those services, based on the fact that it is separate from the school, and therefore accessing those services in a strip mall or somewhere that's a long distance from their home can be very difficult. We continue to refer kids for access. However, we feel that if we had that funding source with a site-based program, we have implored County Mental Health to provide site-based services. However, due to a lack of resources and staff, or what they deem a critical number to school for that to be cost-effective, that has not been the case. So
you're saying you don't have the service providers in your area. Do you have the capacity within your local education agency to provide the direct service if you had the funding?
Absolutely. We currently have 21 mental health therapists, a cadre of behaviorists, and other specialists to provide those services, and this would only help us to provide further enhanced service. And as I mentioned, before AB 114, we had 129 students accessing services. Now we have over almost 600, 577 students.
Mr. Chair, could I ask, it's a technical thing, but I assume that the money always goes from the state to the local county to provide the service. Even if the committee passed this and the legislature passed this, that wouldn't change that funding stream. And so I don't really understand how we could do that, if we do this, if it will really change anything for the Elk Grove District. And what I hear Mr. Cooper saying is young people need services, and I'm for that. And if there's a way to get that for Mr. Cooper's district, I'm all about it. But it seems to me that the state provides the money to the county, and that even if this committee were to pass this and it passes through the legislature, that funding would still go through the county structure, from the state to the county structure. Is there any direction from our committee staff on this, or am I just making it up?
You're not making it up. Assemblymember Thurmond, your underlying understanding is accurate. The counties can still direct the funds, but it would expand the scope of some of the local authorities and how they're used. So would anyone like to amplify on that?
If I may, there is an inequity in the state regarding which SELPAs are currently able to access the EPSDT funds because there are some SELPAs, for example, a Desert Mountain SELPA, several other SELPAs more in Southern California that are able to access those funds because they were granted permission at the local level to be certified to access those funds. Not everyone has that local permission. For example, when we, Yolo County, asked for permission to be certified, we were denied, flat out. Okay? So everyone has a different story in the state, but frankly, the bottom line is that there is an inequitability throughout the state. And so what we're requesting is a level playing field. That everyone is allowed the option to access those funds and being granted that certification at the local level. And then the decision is if we have the relationship, then you could still have that relationship with county mental health or be able to be vendorized or certified to access those funds.
Is county mental health here today? I thought I heard someone reference that there was a county representative. Is county mental health here today? I don't have any immediate questions at this time. I'll come up with another one, though.
Mr. Thurman?
So I'm going to get the motion
Thurman?
voted on, then before that is Assemblymember Thurman.
Mr. Thurman, directly to your question of it going through county mental health, Ms. Vasquez's analysis at the end talks about the mental health waiver and the state plan and waiver. We think this bill very well may necessitate a change in that waiver process because it would create an opportunity for school districts to get that access, which now, as you indicate, has to go through county mental health.
Okay, Assemblymember Thurman, do you have more? Okay. Assemblymember Lackey.
Yeah, mine's not so much a question other than just to thank Assemblymember Cooper. As a former special education teacher, I can clearly see the benefit that this bill brings. And as a former school board member, special education will greatly benefit by this, and I appreciate this very much.
Thank you. Additional comments from members or questions? I think. Who's that? Please step to the mic and make your comments. Thank you for being here.
Hi. Good afternoon, Chair and members. My name is Farah McDade Ting. I represent the California State Association of Counties, and I apologize, I hustled over here. Someone said that the committee was asking for a county mental health representative. Our county mental health or behavioral health director's representative is in another committee, and I wanted to offer my help, if I could, to the committee on questions about this bill.
Assemblymember Thurman.
Thank you for hustling on over here. You know, it's been stated that for the LEA that represents Elk Grove students, that they cannot get the funds they need to provide mental health services to the students, which we want to make sure happens. Mr. Seelix has raised concern that the county behavioral health should do that, and I've asked just a technical question. How is it possible for an LEA? Are there LEAs in the state that provide this directly? Because my experience has been thus far that only county mental health agencies receive the funds, EPSDT funds, and then they allocate them to providers to provide the service.
Assemblymember Thurman, that's a great question. My understanding is the same as yours, that counties receive the funds. It was realigned in 2011 realignment. However, there are some SELPAs who do have long-standing contracts with the county, a few throughout the state, where the county works so collaboratively with those SELPAs that the funding that the county receives for EPSDT is passed on to those SELPAs from the county. But your basic understanding that the funding flows through the counties is correct.
Is there any legal provision for a SELPA to receive the funding, the EPSDT dollars, directly from the state, as opposed to the arrangement you just described, subcontracting with the county?
Not to my knowledge. I am not I don't know the statute by heart. My understanding is that is the intent of this bill, is to allow the funds to flow directly to a SELPA or LEA rather than through the county.
Do you have any sense of what the impact would be if we are able to grant this individual SELPA to provide these services? They've said they don't have nonprofit providers. That's a valid, compelling argument. They say they have the capacity to deliver the service. That's also compelling. It sounds like there's some issues with collaboration between the SELPA and the county, but are there any negative impacts that you're aware of if the funding went directly to the school district and not through county behavioral health?
There's several technical issues and hurdles. Foremost, the federal waiver that county mental health agencies operate under to provide the EPSDT services. So unraveling that ball of twine would be very, very difficult. I think that since the AB 3632 mandate was removed from the counties and placed back with the schools are allowed to use their federal IDEA Act funding for some of these services in conjunction with the counties on the EPSDT. I would note that the EPSDT program is a very specific program that requires a clinician and highly trained personnel to deliver, and that counties, again, as the mental health providers in our communities, are the best choice for delivering those services, whether it's a contract model, a partnership model, county only. That's not to say that these SELPAs aren't doing great work in their schools. They are. We had a lot of conversations about the AB 3632 mandate being lifted from counties. But I would say that community mental health programs reside with the counties. We have the clinical expertise, and we think it would be problematic for the money to go directly to schools. Again, it would only reach the children attending those particular schools, perhaps not children who are in independent study programs, other programs, or in other areas of the county.
My final question is to the folks in Elk Grove. Do you have the master's level clinicians who are prepared to provide the direct service to and someone to supervise them to make sure that they get their hours and they do their billing and things are done according to the psychological appropriate standards?
We absolutely do. In fact, a lot of our current employees were former county providers that chose to come to the school district.
Got it.
So, yes, we do.
Thank you.
Thank you for your questions, Assemblymember Thurman. Thank you for the hustle over, for your responses. Appreciate it.
Thank you, Chairman. I would like to add that CSAC does not have an official position on this measure at this time.
Thank you.
Thank you.
Appreciate you being a resource for us. Any other committee comments? We have a motion. We have a second. The motion is due pass to appropriations. Assemblymember Cooper, would you like to close?
I just want to say I want to thank the committee for their thoughtful comments. This is really about site-based delivery of services for our children that truly need them. That's the reason I brought the bill forward and support it, and I respectfully ask for your aye vote.
Thank you, Assemblymember Cooper. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Aye. Mainshine, aye. Bonilla? Burke? Burke, aye. Chavez? Aye. Chavez, aye. Chu? Chu, aye. Gomez? Gonzalez? Hernandez? Lackey? Aye. Lackey, aye. Nazarian? Patterson? Patterson, aye. Ridley Thomas? Aye. Ridley Thomas, aye. Rodriguez?
Aye.
Rodriguez, aye. Santiago? Aye. Santiago, aye. Stein North? Thurmond? Aye. Thurmond, aye. Waldron? Wood? Wood, aye.
The bill passes 12-0.
Thank you.
Thank you, Assemblymember Cooper. Next, we have item number 17, AB 1133, Assemblymember Ashajian.
Mr. Ashajian, you may proceed.
Thank you, Mr. Vice Chair.
We have a motion and a second and a support.
I respectfully ask for your aye vote.
Well done, Mr. Ashajian. Witnesses in support?
Aye vote.
Ben Rubin on behalf of Children Now, co-sponsor of the bill. Thanks for your consideration.
Thank you.
Scott Lindstrom, Time for Kids, advocacy organization for mental health services in schools for California. We encourage your aye vote. Thank you.
Thank you. Any other witnesses in support?
Rusty Selix, Mental Health America of California and California Council of Community Mental Health Agencies in support.
Maggie Merritt, Steinberg Institute, in support.
Sawait Sium, Health Access California, in support.
Kathy Hall, California State PTA, in support.
Stuart Thomas on behalf of the California Medical Association, in support.
Kevin Tromer on behalf of the 26,000 students in Compton Unified School District, in strong support. Thank you.
Danielle Mollet, California Alliance of Child and Family Services, in support.
Any other witnesses in support? Seeing none. Witnesses in opposition? Seeing none. Questions or comments from the committee? Seeing none. Mr. Cajun, you may close.
Thank you for your consideration, Mr. Chair. Respectfully ask for I vote.
We have a motion and a second. I'd ask the motion is due pass to approps. I ask the clerk to please call the roll.
Bonta? Mainshine?
Aye.
Mainshine, aye. Bonilla? Burke? Burke, aye. Chavez? Chavez, aye. Chu? Chu, aye. Gomez? Gonzalez? Hernandez? Lackey? Lackey, aye. Nazarian? Patterson? Patterson, aye. Ridley Thomas? Ridley Thomas, aye. Rodriguez? Santiago? Santiago, aye. Steinnorth? Thurmond? Thurmond, aye. Waldron? Wood? Wood, aye. 10-0.
10-0. Motion passes.
Thank you, sir. Appreciate it.
Thank you.
Thank you, guys.
Thank you. Next up is Ms. Waldron, item number 1, AB 68. Ms. Waldron, you may proceed.
Thank you, Mr. Chair and committee. Excuse me. I'm here to present AB 68, the Patient Access to Prescribed Epilepsy Treatment Act. And I want to start off by saying I will be taking the amendments in the committee analysis to limit the bill to anti-epileptic medications for treating patients with epilepsy. And in addition, I agree to the additional amendments and believe all affected parties involved can work together on improving the bill. And I want to thank the chair and the committee for working with us on this.
We have a motion. Do we have a second? Second. We have a motion and a second.
Just briefly, legislation does not bypass the utilization controls put forth by Managed Medicaid. In fact, gives them the first opportunity to meet the needs of the patient as prescribed by their physician. In addition, only a minority of California's epilepsy patients will actually need this extra step. Most are effectively treated with formulary drugs. And currently, 17 states offer open, unrestricted access to Medicaid patients with epilepsy to anticonvulsant medications. And there are a couple of reasons for this. The prevalence of epilepsy is low, at approximately 1.4% of the population. The gold standard medication, which 70% of patients respond to and 50% are completely stabilized on, is generic. And the cost of hospitalization, estimated at $8,000 per breakthrough seizure, far outweighs the cost of the medication. For these reasons, 17 states have made the decision contracting for this class of medications is simply not worth the risk to patients for a very minimal, if any, financial cost. So I just wanted to mention that Jerry Jaffe with the California Chronic Care Coalition will be here to witness on the bill. Thank you.
And we have a support. Witnesses and support.
Jerry Jaffe, California Chronic Care Coalition. The only thing I want to add is that if the wrong medication or one that doesn't work with an epileptic patient, it costs approximately $8,000 to go to the emergency room for that to happen. So by having this bill and getting a small number of people getting access to the medications for epilepsy, most of which have been perfectly fine and been tried and true drugs. They're not specialty drugs. Just doing that, just handling a few number, you could save $8,000 per patient. That's a small investment. You'd save a lot of money.
Thank you. Further witnesses in support?
Mr. Chairman and members, John Valencia here on behalf of Synovian Pharmaceuticals in support of this measure.
Thank you. Further witnesses?
Thank you, Mr. Chair. Eduardo Martinez, California Medical Association, in support.
Jimmy Jackson, Biocom, in support.
Is that microphone not working? Yeah, that's
Greg Herner on behalf of the California Healthcare Institute in support.
Okay. Any other witnesses in support? Seeing none. Witnesses in opposition?
Beth Capella on behalf of Health Access California. We were previously opposed to the bill. We want to thank the author and her staff for reaching out to us and working with us to help to address our concerns. We will continue to work with her and, of course, the committee staff as the bill moves forward to further polish it. But we really very much appreciate acknowledging that the Medi-Cal formulary, which has saved the state of California billions of dollars, which is something that we know the author supports as well as this committee, is an important part of our state budget process, and that the amendments, which will create an urgent appeal, will help patients get the drugs they need while respecting the cost-saving structures we have. Thank you.
Thank you.
Mr. Chair, members, Nick Luizos on behalf of the California Association of Health Plans. We have an opposed position on the current version of the bill. We got the amendments like an hour before the hearing, so we're still looking them over. We'll take a look at those amendments and let the author know whether our position has changed. Again, the problem with the existing bill is similar to the bill that Mr. Holden had before the committee in that it removes prior authorization allowance for Medi-Cal managed care plans on a drug which is oftentimes prescribed for off-label use, and that may not be appropriate for all patients. So we'll take a close look at the amendments. If they change our position, we'll let you know. Thank you.
Thank you. Any further witnesses in opposition? Seeing none, questions or comments from the committee? Seeing none, we have a motion and a second to pass as amended to approps. Ms. Waldron, you may close.
Thank you very much. I urge an aye vote.
I'd ask the clerk to please call the roll.
Bonta? Mainshine?
Aye.
Mainshine, aye. Bonilla? Burke? Burke, aye. Chavez? Chavez, aye. Chu? Chu, aye. Gomez? Gonzalez? Gonzalez, aye. Hernandez? Hernandez, aye. Lackey? Lackey, aye. Nazarian? Patterson? Patterson, aye. Ridley Thomas? Ridley Thomas, aye. Rodriguez? Rodriguez, aye. Santiago? Santiago, aye. Steinnorth? Thurmond? Thurmond, aye. Waldron? Waldron, aye. Wood? Wood, aye.